Most people think that a diagnosis of osteoarthritis requires a fancy MRI or perhaps even seeing an expensive specialist. Here's the little clinical secret though. We can actually accurately diagnose knee and hip osteoarthritis just by asking you a few simple questions and then asking you to perform a few physical tests. That's it. And in today's video, I'm going to show you exactly what those questions would look like and what those physical tests would be so that you can get an idea of what's causing your pain at home. My name is Paul Carson, the knee pain expert at Fizzi, and I help people like you understand, treat, and prevent knee and hip pain through things like exercise, education, diet, and self-management. So, the first and most important step is the clinical presentation, which is basically just how you feel day to day. My first question would always be, how does the joint feel in the morning or when you first wake up? So, this could be your knee or your hip joint, depending on the situation. What I'm looking for here is you to report stiffness and pain in that joint that lasts up to 30 minutes. And after that 30-minute mark, it begins to ease off and the day gets easier as you go on. This is a classic sign of osteoarthritis. The next one is pain with use. This is another classic sign of osteoarthritis, is that when you are active and moving, you feel more pain and stiffness compared to when you are sitting down and resting and doing nothing. Finally, another sign is having a lot of difficulty going up and down the stairs, particularly if you report pain at the front of your knee around your kneecap when you go up and down the stairs. That is another good sign that we are dealing with potentially knee osteoarthritis. Step two is the physical exam. So we're going to begin with the knee osteoarthritis physical exam, which is very easy and has two steps. Step one, we want to have a feel of the knee joint and see how it feels and how it looks. So what you're going to do is sit with your back up against the wall and your legs out flat. And you're going to bend your knee up to create a triangle shape. And this will kind of expose the knee joint. And then what you're going to do is just get in there with your hands around your kneecap. It should almost feel rocky and hard and uncomfortable. And usually it looks bigger than you remember it. And that is a good sign that you've got knee osteoarthritis. The other thing is what we call the crepitus, which is basically the noise that you hear. I like to think of it as the snap, crackle, and pop. Just like when you had Rice Krispies and you would pour the milk on them and your knee just starts to go. Those noises are totally normal and safe and very common in knee osteoarthritis, but you want to try and see if you can feel them. So all you need to do is place your hand over your kneecap and just slide your heel forward and back nice and slowly. And that's all we're really looking for. And if you feel that or hear that, then that's another sign because it's very common. The physical assessment for hip osteoarthritis is also very easy. You need to look at two movements: hip internal rotation and hip adduction. Don't worry, I'll explain what both of those are. So, internal rotation is easy. If you look at me and standing right now, you can see that I can rotate my foot in and out. This is caused by my hip rotating. It's that simple. In this position in standing, to rotate in the way, all I have to do is just turn my toes and my foot towards the midline. The research would suggest that an internal rotation of 15 degrees or less is a good sign of hip osteoarthritis, but it's very difficult to know what 15 degrees is, so do not sweat it. If it feels stiff and painful and doesn't look like a lot of movement, that's a good sign. Especially if you can compare it to the other side, which is hopefully not painful, and it is moving a bit more freely, a bit quicker, and a bit smoother. The second movement that you want to do that you can also check in standing is hip adduction, which is basically just how much your leg goes right across the other one. And again, you can test this in standing just by taking your leg out and trying to move it across and seeing how much movement you have there, comparing it to the other side. If this movement feels difficult, feels reduced, feels stiff and sore, these are all good signs. In clinic, all we would do is just do this actively, showing you how to do it, and then passively. So we would take our own hands and try and move the joint as well and see what we could feel. But that's it. The last point is this, and you're all probably asking yourself this question: do I need an x-ray? Well, not really. The research shows that actually there is no correlation between what the x-ray image looks like and the pain and symptoms that you experience. What this means is that you could have severe knee osteoarthritis in terms of imaging. It would maybe look like your cartilage has really worn down, but you could have no physical symptoms whatsoever. And on the other end of the scale, you could have an x-ray that looks really, really, really good and clean and healthy, but yet have very severe pain and stiffness. So therefore, it's often not needed. It can be used as a good way to see how the osteoarthritis is progressing, but in terms of diagnosing and understanding what's going on, it's not necessary. Everything that we have just done previously is more than enough to begin your treatment process. So that is everything for today's video. I hope this helped you understand whether you may or may not have knee and hip osteoarthritis. If you enjoy this style of content where I give you self-diagnosis tips to help you understand your body better, please let me know in the comments below. Hit the like button, hit the subscribe button, and I will see you in the next video.